nakikita niyo yung aking slides, tama?
Yes, we see it, Ma'am Bing.
So, mamaya tatawagin ko si Doc. Doc Mikey, you can hear me, right? Can you welcome them?
Yeah, yes, I can hear you.
Hey.
Hello, everybody. Good evening.
Are you on the road or you're
No, I'm in the office waiting for my wife to pick me up.
Oh, yan. Sige, mamaya pa siya. Okay, so, hindi ko na papatagalin, ano, si Doc Mikey is our physician, family physician for 35 years. O, di ba? More than pa nga yata. A seasoned acupuncturist, okay? Researcher, scientist. Si Doc Mike kasi centuries-old wisdom ng proper diet, okay? So, detoxification, breakthrough cutting-edge knowledge on human microsystems and microbiology, personal treatment of human illnesses, okay? Pinagsama niya yung Eastern and Western medical arts practice to his practice of integrative medicine. No? UP Medicine doctor po ito, College of Medical School in UP. Okay, integrative and lifestyle medicine, medical acupuncture. Let's all welcome Dr. Mike Vergara. Kamusta, Doc?
Good evening.
Advertise ko yung ano mo, the CEO of Centro Holistico, your port clinic. Kamusta, Doc?
Yeah. Well, we're doing well. The clinics are doing well. They're open now.
Yeah.
We're not open 100% because we want the density or the number of patients inside the clinic to be controllable, diba?
Yeah. And you're following protocol kasi.
Oh, so ngayon we kind of cut down, no? So para hindi masikip.
Oh, yes.
Social distancing.
Yeah, and also I know you can do naman telemedicine, which I'm referring a lot to you. I just give them the number of the clinic. No,
Yeah.
so those who are interested to see or call Dr. Mike, just ask for an appointment kasi talagang busy po ang ating doktor. But I'm happy you're here, Doc. No? So for tonight, kidney health ang ating pag-uusapan. Very, very basic lang naman ito. No? That's why meron na akong ditong disclaimer. It's not to diagnose or to cure, but it's more of awareness and educational purposes lang naman talaga, no? Very basic, but again, if you have questions, mamaya sa chat room, I know you will have a lot of questions, pero baka yung questions ninyo, matap ko na rin. Okay? So, we can start now. Are you ready, Doc?
Yep, okay. Ready when you are.
Okay. So, what are kidneys? No, define ko na lang. Let me define first. No? Kidneys are two bean-shaped organs in the renal system. Okay? They help the body pass waste as urine. No? Yung ating wee-wee. Diba? They also help filter blood before sending it back to our heart. The kidney perform many crucial functions, including or maintaining overall fluid balance. Okay, so that's the definition of the kidney. Okay, so ito yung itsura niya. No? So those of you na hindi pa nakikita yung kidney, I'm introducing people. Sante, this is kidneys. Dalawa yan, okay? Parang fist size, tama? Tama ba ako, Doc? Bean shape? How big is the kidney?
Yes, it's bean-shaped, but it's not as big as a bean. Okay, it's as big as a small fist, no?
Yes.
Yung kamay. Wait, I'll transition to the card. Nandiyan na yung wife ko.
Okay. So
yeah, no, but I can still hear you.
Okay, good. Okay, so Sante partners, this is how the kidneys look like, no? Bandang likod po yan naka-locate, no? Sa bandang likod, that's why pag meron kayong pain, sa back pain, ayan, lower, no? So, it might, no, the organs na might be affected are the kidneys, no? So, ito ang ginagawa niyan, filter ang mga dumi, no? Nagtatanggal sila ng mga ng dumi. That's why, yan, yung ureters, yung dalawa na nakikita ninyo, okay? Yan siya, kidney fast, tapos dito sa bladder, okay, dyan napupuno yung ating mga wee-wee. Okay? Pag napuno yan, papas na dun sa urethra, no? So sa mga lalaki, through you urinate through your penis, and then sa mga babae through the vagina. Okay? So yan lang ang itsura ng kidneys ninyo. Nasa likod, bandang likod sila. Actually, napakaganda talaga ng katawan. I'm looking for mga pictures kasi that's why I'm really interested with the human body. Alam mo, Ian, yung katulad ng mga buto, yung mga buto natin, the bones, no, it encases yung mga, ang tawag nito, it protects yung ating mga organs. Katulad kunyari, yung puso natin. Imagine mo kung walang buto or walang rib cage na nagko-cover or nagpo-protect, no? Ito rin yung sa kidneys natin, kaya may mga spine, 'di ba? Yung mga sa likod natin tapos may mga buto diyan, pinoprotektahan nila yung mga organs. Our body is really
The skull is beautifully designed to protect our brains.
So pagka tinitignan mo yung anatomy, that's why I'm really interested with the human body. In fact, I really wanted to become a doctor. Kaya lang, ang hirap pag-aral. Pero yan, katulad yan, may specialista. Diba? May nephrologist na tinatawag. No? I just want to show everyone, very basic lang naman tayo, ganyan ang itsura ng kidneys. Okay? So we need to take care of our kidneys. Dapat naman talaga alagaan. Kasi dalawa yan, pag natanggal yung isa kasi binenta nyo, diba? Diba may nagbebenta ng nagbebenta ng mga organs. So magda-dialysis ka, no? We'll go to later mamaya. Tapos tinanggal din yung isa, yung function nito, magdodoble siya talaga no? What more kung dalawa na yung tinanggal, no? So we really have to take care of our kidneys. Why do we need to take care of our kidneys? Bakit? Diba? Kasi kidney function is vital for life. Importante talaga. Alam mo, nung nag-anatomy ako noon, sabi nung doctor, nung teacher ko na doctor, sabi niya, yung mga organs daw natin sa katawan, nag-uusap-usap sila. Parang sinasabi nung heart, ako ang pinaka-importanting organ. Sabi naman ng kidney, hindi ako, kasi nagtatanggal ako ng dugo, nagtatanggal ako ng basura. 'Di ba? Sabi naman ng eyes, hindi ako. So each of the 72 organs, imagine mo, Ian, we have 72 organs. Lahat yan, pwede nating ma-replace except for the eyes. Itong kidneys, nagkakaroon ng, nagta-transplant, pero i-reject pa rin ng katawan natin. Kahit na 20 years mo pang ginagamit or 50 years, time will come, i-reject pa rin natin ang katawan. Diba? So, kidney diseases are silent killers. O, diba? Tatakutin namin kayo. Tatakutin, no? Silent killers. Ito. Kidney conditions. I will just mention, no? Siguro 6-7 lang yung mga kidney conditions. I-define ko lang sila. And then maybe Doc Mikey can just add, no? Ito, no? Katulad nito, chronic kidney disease. Some of you might have it. Kidney failure, kidney stones, glomerulonephritis, acute nephritis, urinary tract infections. Ayan, very common sa babae kahit bata, may UTI. Pyelonephritis. Okay, so we go with the chronic kidney disease, the CKD. Okay, it means your kidneys are damaged and cannot filter blood the way it should be. No? The disease is called chronic because the damage happens slowly over a long period of time. So pagka nagpunta na kayo sa doctor, 'di ba, nagpapa-laboratory test tayo, chronic ibig sabihin it's been there already. Hindi mo lang minsan kasi nga asymptomatic, no? So Doc, can you hear me?
Yes. You know, yung term chronic normally, refers to a disease or a condition that is more than 2 weeks old. 2 weeks, because an acute condition, like your acute nephritis that you mentioned, is from 0 to 14 days. So in general, ang ibig sabihin ng chronic is for at least 2 weeks and more.
Okay, so it's been okay. So that's the chronic kidney disease, no? Ang kidney failure naman, when they say it's kidney failure, it means your kidneys are damaged. Okay? It means that 85 to 90% of your kidney function is gone. Tama,
Yeah.
Doc?
Yes, yes. You know, the kidney actually is a very, if you're healthy, you know, it is a very efficient machine. No, it filters the blood, diba? And it filters also the fluids, no, water and all that stuff. No? It is so efficient such that if, diba, we have two, no? If you have two normal kidneys, if you take out one kidney, you can still live a normal life. No, if you cut the remaining one kidney into two, or kalahati niyan, or in short, you have one fourth na lang, no, you can still live a normal life. Even if you cut that one fourth to one eighth, pwede pa rin, okay? Although I'm not telling you to not take care of your kidneys, no, but it is a very efficient, organ, and the only time it can actually get damaged is if you take into your body, no, poisons, no, or things that you are not supposed to put into your mouth, no, inorganic stuff, uh, foods that are rich in, let's say, pesticides, diba? Herbicides, and all of these will pass through your kidney, no, and they can damage your kidney if you do it, on a regular basis. Then you get into trouble, diba? Then your kidney starts, getting into trouble. And when the kidney gets into trouble, konektado yan eh. As you said, they talk to each other. No? The heart gets into trouble, the circulatory system gets into trouble, diba? Even the lungs can get into trouble.
So so that's two chronic kidney conditions, so the CKD and the kidney failure. When we say naman glomerulonephritis, okay? So yung E sa dulo, no, itis, ibig sabihin yan, inflammation. Tama? It's an acute
Yes.
inflammation of the kidney, typically caused by an immune response. Okay, so ano tong glomerulonephritis?
Yeah.
When
Yeah.
a doctor say you have a glomerulonephritis, so the kidneys is inflamed. Okay, so when we say
Yes. It's a certain part of the kidney where the exchange of the fluids, no, and the blood, no, where there's an exchange, and the division of the good and bad, it happens in the glomeruli, no. And kung yan ang tinamaan, yan, glomerulonephritis ang tawag.
yes, okay. So acute nephritis occurs when your kidneys are suddenly inflamed, okay? Has several causes and can ultimately lead to kidney failure if left untreated. So una muna, acute nephritis, tama, Doc?
Yes, oo.
It will lead to
Yeah.
chronic kidney failure.
Yes, yes. Or if you don't treat it right away. No?
Oo. Kaya yan, tama. That's the key. Okay, UTI, very common. Sabi ko nga, sa mga babae, bakit? Kasi your urethra and then your vagina is very near to each other, no? Is an
Yeah.
infection on part of your urinary system, which includes your kidneys, bladders, ureters, and urethra. No, when we say urethra, ito yung pinaglalabasan ng pagwiwi, no? Sabi ko nga sa babae.
Oo, correct.
Okay? So women are more prone, usually caused by a bacteria. Kasi ang mga babae minsan, they do not wash properly, diba? Or yung ibig sabihin yung pag-wipe nyo pa lang, diba? So it should be front, back, front, may mga
Yes.
ganito, diba? So, yung iba, UTI pa lang, ayan, nilalagnat na kasi sobrang daming bacteria. That's why we really have to be very careful, women, no? We really have to be very careful. Always wash in a proper way. Kasi this will lead, no? Di ba yung bacteria will go up, tapos ayan. UTI,
Yeah, correct.
tapos ang kidney failure na. That might happen, tama?
Yes, that's right. Kung chronic ang UTI, yung parating naging UTI, di ba? ayan, it can lead to eventually to failure of the kidneys.
So women, very, very careful. Watch, no? Akala natin normal. No, it's not. No, having a UTI, mabilis lang yan, di ba? Proper washing pa din. Always wash.
Proper hygiene. And may study that show that women in offices, no, who have desks that are far away from the toilet, no, get more UTI than women whose desks or workplaces are closer to the toilet. Meaning, kapag pinipigil lang ang ihi, no, mas madali kayong magkaroon ng UTI.
Yes, oo. Lalo yung mga, yan, tama, workplace, tama, Doc. Mga sales lady, di ba? May mga may break lang sila. Or minsan, mga babae, nako, mga tamad.
Tamad, yeah, correct. Oh.
Sorry.
Kasi malayo ang banyo ganyan.
Oo. Meron ako one time, kami nung daughter ko, kwento ko lang, we're inside already the bathroom, ha? Sabi ko, you go, make wee-wee. Ayaw pa niya. Sabi ko, we're inside already. Sabi, hindi naman daw siya na wee-wee. Di ba minsan kasi you do not feel na wee-wee ka or you wanted to urinate, but there's already dun sa ureters.
Yes. Yeah.
Na yun. So, wag niyong antayin na ihing-ihe, tsaka iihe. Diba? So, dapat...
Tapos wala kang makitang banyo. Nako. Doon ka mag-UTI.
Ayan. Guilty yung mga babae. Or even the male. O, diba? Minsan mga males din tamad na mag-weaving.
Yung men, basta may puno di ba? May pader. Okay na. Wala nang wipe, shake na lang, di ba?
Pero kasi katulad nito, I'm just laughing, pero it start from there Akala nyo, normal, UTI, but hello, wag nating hayaan. Kasi again, yun nga, those stages by stages, no? You might see this as a very...
Yeah, UTI is not normal.
So, conditions, no? Madaming puzzles, maraming okay? So, pyelonephritis is an inflammation of the kidney usually caused by a bacteria. Symptoms:
infection,
fever, nakihilo, burning sensation when urinating.
Normally may nana na yan.
Oh wow. So nag-start lang sa UTI tapos 'di ba, it will go from there, na-inflamed, 'di ba? So proper hygiene. So these are, we just simple, not simple, but these are the common kidney conditions. Okay? And then the stones, ayan.
Okay, we have to stress, especially when we start talking about stones, the importance of water, di ba? Kasi it's like we're talking about hygiene, di ba? It's like we say, okay, wash your hands all the time. Pero sa inyo, walang tubig di ba? How can you wash your hand all the time? Di ba? Ganyan yan. It's the same thing with the kidney. No? You always have to provide water sa kidney para lahat ng germs, lahat ng bacteria, and in your next topic, the stones, no? Mga crystal, lahat yan matanggal ng kidney.
Correct. Ang sakit niyan pagka, 'di ba, nag-stuck dun sa ureters, pinagdadaanan, 'di ba? Minsan, okay, the kidney form when your urine contains crystal forming substances such as phosphorus, oxalate, sulfur, then the fluid urine can dilute. So yung mga pagkain that are rich, 'di ba, in calcium, uric acid, nagfo-form phosphorus. At the same time, your urine lacks substances that prevent crystals from sticking together, creating an environment for kidney stones to form. O, diba? Huwag kayong uminom ng tubig. Huwag kayong magwiwi. Parang yan siya, diba? So, doon na siya nagsistart. Okay. Warning signs of kidney problems. No, these are the warning signs. Pag nararamdaman niyo na to, go to a doctor. Parati naman, we always say, no, go to a doctor, have your laboratory test, no? Tignan yung mabuti. Kay trouble sleeping, hindi makatulog. Fatigue, napapagod, inability to concentrate. Ayan, hindi kayo nakikinig dito. Di ba? Nagsi-cellphone, nagluluto. Inability, dry, itchy skin. Pag dry, itchy skin, doc, usually sa ang partes ng hands, or I think it's around the body.
Yeah, in areas that make pawis normally, no? Your neck, your elbow, yung the part the cubitus or antecubitus that's in the other opposite side of the elbow, diba? Yeah, things like that. So your hands, no? Especially when you lack water, diba? Kasi you know the kidney works together with the lung. Now, this is already integrative med, okay? The kidney gets the water, no, and it distributes it around the body, no? So, like the skin, diba? The skin needs water. If not, it will dry up, diba? And when the skin dries up, ayan na, diba? That's when it becomes makati. Parang sunburn yan, no? Dahil lang sa kulang sa tubig, no, at kulang sa dilig ng skin, you start getting itchy, urticaria, diba? Mga tapos minsan allergic pa sa mga scratches, talagang it can become bad, no? The skin condition can become bad.
Correct. So, kung may mga ganyan na, no, watch out for this warning signs, no? Again, water, di ba? So, lalo ngayon, sobrang init. Talagang we really have to drink a lot of water. Inom lang ng inom. Sasabihin lang ko, kasi mawiwiwi ako, ayan na naman.
Yeah.
Okay, increase or decrease urination, di ba? So, those are
Correct.
signs.
Yeah.
Blood in the urine. So pag nakita nyo na may blood sa pagwiwi natin, go see a doctor. Foamy siya, parang mabula, no? 'Di ba? May bula-bula yung natin.
Yeah.
Puffiness around the eyes, 'di ba? So that's one ito po yan. Yung mga puyat. Pero iba yung puffiness ng around the eyes eh. You can see, 'di ba? If there's a kidney problem already. Pag kasi yung puffiness, no? Foot or ankle swelling, namamaga yung mga paa.
Yes, right. Edema. Edema ang tawag dyan, di ba?
So, reduce appetite. Hindi makakain. Okay? Muscle cramps. Parating namimintig. Ano ba yan? Cramps. No? So, these are... Namumilikat, yes, that's right. No, napupulikat. Parati kayo napupulikat, you have trouble sleeping. Lalo kung if you are experiencing 3 or 5 or more symptoms, may blood ka sa urine, foamy, mabula, parati ka namumulikat, parati ka napapagod, di ba? Parang hindi ka makatulog. These are signs. So if you have already 3 or 5 or more signs, warning signs na po yan, go see a doctor. Okay, so
when we talk about blood in the urine, sometimes you cannot see it visually, with your eyes, no. But if you have a urinalysis, yan, siyempre makikita yan. So normally, the proper color of urine is light yellow. Okay? Kapag nag-dark na yan, or orange especially, di ba? O yan may problema siguro. No? You're either kulang sa tubig, kaya very concentrated, or may dugo sa ihi, di ba? So kapag ganyan, kailangan talaga,
oh yes.
Kailangan ipa-examine.
And also, you have to be very careful. Kasi baka mamaya, kumain pala ng dark colored food. Like, yung dragon fruit, di ba? Every time you eat that, your mouth becomes red. Di ba? So yung iba, hindi sila aware doon, mapula yung aking wiwi, pero iba yung blood. Iba yung blood. Iba yung yellow. Kasi may mga, that's why, again, go to a a doctor. Kasi iba, tea-colored urine. Alam niyo yung tsaa. Pagka
Yan, oo.
ng ating mga ihe, magpa-check up
Yeah.
naman.
Oo. Yan, hyperconcentration yan.
Yan, oo. So, kailangan yellow ano lang, no? Light yellow is the color of the urine. Okay?
Correct.
So that's why every day, even in our poop, no, sa pag-poops natin, you really have to check. Because that's your poops, that's your poopy, diba? So you have to check, no? So every time you go to the bathroom, you check talaga, no? So how do we keep our kidneys healthy? So very, very, very basic lang naman, okay? So 10 lifestyle habits to maintain the kidney health. Ito 10 lang, pero I know some of us, itong 10 na to hindi pa nagagawa. Very basic. Ito, maintain a healthy fluid intake. O anong masasabi nyo dyan? Tubig. Tama ba, Doc? 2 or 3 liters in a day? Especially now.
It really depends on your activities. Diba?
And also the height.
Oo. So the more you think you're going to sweat, the more talaga you will have to
Ako, I drink 2 or 3 liters in a day. And sometimes I measure. Alam mo yung isang, 8 ounces, 800, no? 800 ml. So you drink 3 or 4, diba? You get 2.4 or liters. Talagang kailangan inom tayo ng inom kasi mawawash off talaga. Maintain a healthy fluid intake. Tanong, nakakainom ba ng maraming tubig? Check, yung iba hindi. Pangalawa, eat healthy.
Yeah.
A healthy diet can keep your weight.
All this time?
Si Doctor, very particular dito sa weight.
Yeah. I think earlier I was on silent mode. Sorry. But by the time you feel thirsty, if you feel thirsty, that means you already lost 20% of your fluids, your body fluids. And that's not good, diba? So you just have to keep on drinking and you drink depending on your activities and the season. Diba? Kapag summer, drink more talaga, diba?
Eat healthy. Okay, so second, eat healthy. Keep your weight in check. So kung ano yung sabi ko nga, tamang timbang sa tamang tangkad. Fit and trim, pinopromote ko na. So, ako talaga maintain ko lang. It's either you lose or you maintain. No? So, ba't tamaan mo at magagalit. No? So, you have to control your blood pressure. Kung ano yung talaga. Kung ano yung normal sa atin. Diba? Kasi each person is different. So, you have to know your blood pressure. Kunyari, katulad ako, 120/80, normal. Pero, ngayon, nagwa-110 na lang ako, 110/70, diba?
Wow, that's good.
Diba? So, ganyan ako. So, I really monitor then my blood. And you have to know, each one of you, no? So, kailangan alam mo yan. Ian, alam mo ba yung blood pressure mo? Anong blood pressure mo? At least ako malalaman ko blood pressure.
Yes. I'm a little bit over what is supposed to be. It's bad for the kidney, di ba, Doc? High blood pressure.
Yes, oo. It affects the kidney a lot.
A lot, no? Especially over a period of time.
Yes, in fact, some medicines, no. In fact, the first drug of choice for hypertension is a drug that works on the kidney, not even the heart.
Oh, what is that, Doc?
It's a diuretic. It makes it makes sure that your kidney is working properly. Makes you make wee-wee.
Oh. Thank
So,
you for that, Doc. Sige.
talaga. So, monitor your blood pressure. Do not smoke. Uy, sa mga nagsisigarilyo, wag na kayo magsigarilyo. Sayang.
Mambing ako yung too hot eh. Parang si Doc, we're too hot. We usually smoke. That's a joke.
We're smoking hot. Sizzling.
Sizzling hot.
Do not smoke.
Joke lang.
Keep regular control of your blood sugar. That's why you have to test.
Ayan, sugar talaga. Yan ang public enemy number 1.
Oh, really, Doc? So actually, it's extreme salty and sweet, di ba? Talagang it both affects the kidneys.
If I were to rank, I'll put sweets as number 1 talaga.
Full-print talaga yan. Blood sugar. Okay? Do not take over-the-counter pills on a regular basis. Alam mo yung mga OTC, bili lang ng bili ng antibiotic, nag-work sa kanya yung, di ba minsan ganyan yung iba eh.
Yeah, oo nga. Oo.
Tatanungin, kunyari, simple sore throat, mag-antibiotic. Kaya nga sinasabi ko din, in my wag na kayong mag-start ng antibiotic kung hindi nyo lang siya tatapusin. Tama ba ako? Doc?
Yeah. But many times you have to be really judicious when to use an antibiotic and when not to, no? Most of the time, if you have an infection, you ask yourself, is it bacterial or is it viral? Diba? If it's bacterial, yes, you may use an antibiotic. But some people, viral virus ang pathogen, they use antibiotics and that doesn't work, diba? So they're just taxing their body, they're taxing their liver.
Oo. So
don't
self-medicate.
Oo. So,
yeah.
Yung sinasabi ni Doc na pathogens, yun yung mga, ang tawag dito, yan, bacteria, viruses, kasi ina-identify pa rin yan kung anong klase. Diba? So, pampatay natin sa kanila kung bacteria yan, dapat yung tamang pangpatay, hindi yung viral siya, tapos nun ganyan. So, do not take over the counter na alam nyo lang, ito maganda kasi
Yeah. Oo nga. Yung gaya-gaya, it doesn't work.
So you really have to be very careful. Wag nang bili ng mga gamot na yan, di ba? Okay, so keep fit and active. Kahit nasa bahay tayo, jumping rope, di ba? Lakad, everyday, lakad-lakad, 10,000, konting jumping jacks, importante, di ba? Keep fit and
active. Yes, yeah. Movement is very important for the whole body.
Yes. Use caution with supplements and herb remedies. Hindi naman lahat ng mga supplements, lahat na ininom nyo, meron na kayong bawang, meron na kayong, di ba? Lahat na. Di ba? Konti-konti naman. Use caution. Pag-iingat.
Yes. Yeah.
Not all herbs are can be taken for a long period of time. Good thing natin, Doc, from birth to old age. So,
yes, kasi that's the one that the Lord gave us Yes. Yan ang sabi ng ito ang kainin nyo, di ba? Sinabi na sa atin That's what you should eat. Eat the greens, di ba?
Hindi lang yung merong narinig kayo sa ibang kumpanya. Ito maganda, ganito. Sinabay nyo, ang dami nyo ng supplements, 'di ba? So, wag use caution, no? Hindi naman extended long term ng paggamit, hindi rin maganda sa akin. Okay? Get your kidney function check if you have one or more of the high risk factors. Yung mga nabanggit natin kanina, yung blood in your urine, foam in your urine, 'di ba? So, magpa-check po kaagad. Okay? Reduce salt intake. Ito yung sinasabi ko minsan, Doc, yung bangus, binabad natin sa toyo, tsaka suka. Tama? Tapos may asin.
Harap.
Rito. Tapos we fry it. When we fry the fish, meron pa rin tayong sausawan na toyo, suka. So, minsan yung toyo, di ba, may suka. Tapos nilagyan pa ng bagoong. Diba? Nakakaloka. Salt intake pa din. Reduce your salt intake. Okay? Let's drink to healthy kidneys. Yan. Okay? Wine. Okay, maganda yung wine. Moderate wine consumption could help keep kidneys healthy. No? And maybe heart in patients who have already kidney disease. Kasi yung mga wines na yan, especially the red wines, correct me if I'm wrong, Doc, na resveratrol, tama?
Correct. Correct. Oo. That's healthy, eh? Oo.
Protective benefits of wine, less is more. Wine ha, hindi beer, hindi vodka, hindi...
Yeah. Wine has resveratrol, especially red wine. It's good for the heart and their blood vessels.
Wine. Dapat wine, hindi beer, hindi vodka, hindi tequila, hindi, okay? So, moderation is key and excess alcohol consumption has been shown to have adverse effects on kidney function. Alcohol can also worsen high blood pressure, a leading cause of kidney disease according to the National Kidney Association. Okay? So, start
Yeah. So something about alcohol, ano? There are there are limits ba? No? Alcohol per se actually sometimes can help, no? Especially if your hypertension is due to stress, diba? So when I have patients, whose blood pressure is high dahil sa stress, I actually even tell them to consider taking alcohol at the end of the day, one or two. No, we call it the rule of two. Kung wine, that's 2 glasses, no, not more. Okay, if it's a hard drink, that's 2 shots, diba? Not more than that, because more than that, your heart is the one that will be affected, no. But less than two, in my case, one lang, no, nare-relax ang katawan, no. So at a low dose, it's good. At a high dose, it's not good.
Okay. So, 2 beers is okay.
2 beers, hindi yung litro, ha?
Oo nga, nakakaloka. Litron. 2 beers, yung a bottle of
Yeah,
beer.
rule of two yan. Rule of two.
Rule of two, okay? So, let's start drinking the wine, okay? Cranberry juice. Cranberries contain compounds that can stop E. coli from sticking to the urinary tract wall. 80 to 90% of all urinary tract infections, UTI, there's a study 10 million doctor visits per year. Does it help with that kidney problem, Doc, the cranberry juice?
Yes, it helps. It helps talaga. It helps clear.
Good. O, kasi yung
It washes off the bacteria also.
okay. So, dapat fresh, no? Not canned. Oo. Merong mga ano talaga, merong mga brand ng cranberry juice. Do not, yung mga nasa canned, wag. Usually boxes or Tetra Pak, no? Yan.
Yeah.
Okay, so that's better.
Kasi the cans carry heavy metals, tin, cadmium, di ba? Aluminum, lahat yan toxic din sa kidney.
Correct. Kasi nandun sa lata, tapos it's been there for many years.
Correct, yeah.
Wag. Talagang canned, wag. Okay. Lemon and lime base. Citrus juices. Lemons. Each year, more than 500,000 people go to emergency room for kidney stone problems. 1 out of 10 will have a kidney stone at some point in their life. The lemon and lime-based citrus juices are good for the kidneys also, Doc.
Yes, because it actually disintegrates mga uric acid stones. Diba? It prevents it from sticking together.
So natatanggal. Kaya nga minsan nawawash off lang talaga dyan.
Yes, oo.
Okay.
It's important sa kidneys that you wash off all the diba? Kasi it filters Anong nangyayari sa filtrate, diba? It has to come out, no? So it has to be washed away. It cannot remain in the kidney because if it remains in the kidney will get sick.
Wawa naman yung kidney, diba? So kailangan tanggalin. Okay. Water, ito kanina, no? Most abundantly available. Sinong walang tubig sa bahay?
Yeah.
Drink it every day. Water is essential to life. Performs many important functions in your body like flushing out toxins, transporting nutrients, and regulating the body temperature. So tubig pa lang, diba? So ang dami na niyang function sa katawan natin. no?
Yeah.
Toxins, nagdadala ng nutrients sa katawan, nagre-regulate ng body temperature. Mainit ka, di ba? So, drink more water. Drinking plenty of water helps to ensure that your kidneys are able to filter waste and from the blood in order to excrete them as urine. Aim for more dilute urine because and kidney stones can occur when you're not drinking enough water. So yun nga lang,
Correct.
so every time na nagwiwiwi ka, at least nalalaman mo na nagpo-function pa na yung kidneys mo. Kasi, kunyari, uminom ka na ng 3 litro sa isang araw, tapos hindi ka pa nawiwiwi sa isang araw. Diba? So you really have to be cautious, no? Okay? Especially in the summer, no? Especially in the summer, it's important to stay hydrated. Sweating
Yes. Yeah.
natin. Sweating is a very good form of detoxification, no? Yung
Yep.
pagkakawis.
Uh-huh.
Due to the extreme heat of summer leads to a loss of water in the body. Less water in the body leads less urine production. The less urine you produce, the greater the chance for stone causing minerals to settle and bond in the kidneys and urinary tract.
Correct. Correct. Oh, yeah.
Try to drink enough water to keep your urine color light yellow. Okay, so Doc, in your opinion, what is the best water to drink? Is it the alkaline, distilled water? Ayan si Ian, meron niyang
Oh.
refined.
Alkaline water is good. No, I don't suggest people take distilled water. No. I think distilled water is for car batteries. No.
Yes.
Oh.
Actually,
Dead water, diba?
dead water.
Yeah, it's dead water. Now there are some people kasi who have problems with too many minerals in their body, no? So they naman are prevented from taking too much of mineral water. But
Yes.
although that's a little more rare, more people lack these minerals, no? That's why it's important what kind of water to drink. No?
Oo nga, kasi ang dami ng klase ng tubig. Mineral water,
Yeah.
vitamin water, diba? So,
Yes. Yeah.
we do not
Alkaline. Yeah.
na marami ka na palang mineral sa katawan, tapos you're taking mineral water pa. So, the best talaga is the alkaline para mabalance talaga.
Yeah, or
Yeah.
purified. Purified kasi.
Yeah. Oh yeah. Yeah. Oh, purified though is okay.
O, i-purified yung sa inyo, Ian.
Purified yung sa amin eh. Water spring.
Yes. Yes. Oh, that's okay.
Kasi alam mo Doc, I don't want to mention the brand, no? Pag pinantitimpla nila ng baby's milk,
Uh-huh.
it's the W brand. I really don't get it why they use distilled.
Yeah.
Distilled is
Even the A brand uses distilled. Eh.
yeah.
That's wrong. Eh. That's really wrong. It shouldn't be.
I'm close to mentioning the names already kasi I want to at least educate people that they're
Oh,
buying this. It's very expensive. Doesn't do any good actually.
Eh, pero sinabi mo na W brand. Sinabi ko A brand, di ba? So, may W, may A.
Oo.
Uh,
Hindi yata yung kulay.
Yes.
O, diba? So, basically, ito palang tubig lang. Very, very important na yung kung anong klase ng tubig na iniinom nyo, no?
of course. Yeah.
So, you have to drink every day, lalo ngayon. Bring your own water bottle, di ba? So, iba kasi again, tamad, ayaw mag-bitbet, di ba? So, bibili ng tubig. Just again, very, very basic. Pero yun nga, yung basic minsan, hindi. Okay, protein requirements, okay. The 20 best foods for protein with kidney, no? Ito lang siya, no? Binabanggit lang din namin. Cauliflower, blueberries, sea bass, red grapes, egg whites, garlic, buckwheat, olive oil, bulgur, cabbage,
Bulgur's like wheat.
Meat. O, kala ko
No,
yung
wheat. Oh, wheat.
bugar pala yung kulangot. Oy, alam niyo yung English, bugar, kulangot.
Hindi burger, mambing ha. Akala mo burger, meat.
Cabbage, skinless chicken, bell peppers, onions, arugula, gulay din ito. Macadamia nuts, radish, turnips, pineapple, cranberries, shiitake mushrooms. Okay? So these are the 20 best foods for yung mataas yung protein nila. That's why important yan
Oh.
for our kidney. Nabanggit lang na. Okay, barley and kidney, yay! Ano ba yung nandun sa barley? Yan ang inaabangan nyo na maganda para sa ating kidneys. If you have a health problem, most likely you are acidic. Okay? So research shows that unless the body's pH is slightly alkaline, the body cannot heal itself. Okay? Too much acid. Okay? If your pH, body's pH or the power of hydrogen is not balanced, you can effectively assimilate vitamins, minerals, and supplements. Your body pH affects everything, no? So dapat daw talaga alkaline yung ating katawan. Alkalinity
Correct.
ng katawan, no? Yung acid, that's the cause bakit tayo nagkakaroon ng mga health problem, no? So ito lang yung guide, okay? So pag medyo dapat yung normal blood pH range, no? 7.35 to 7.45. Pag bumaba na siya, no, na masyado na siyang yan acidosis, yung medyo pula. Okay, or 7.0, yan. It might go to death, no? So kaya yung blood natin very very important yan. Okay, so why is barley very good for our body, no, especially with the kidney health? Because of the high chlorophyll content. The chlorophyll also stimulate the hemoglobin production, yung nandun sa
Correct.
ating
Yeah.
It provides iron to our organs and removes sodium in the lungs. Okay? Chlorophyll improves the blood sugar level. It has wound healing properties and stimulate tissue growth. Chlorophyll helps to build a high blood count, improve anemic condition, and also helps cleanse tooth and bones. Okay, so Doc, add more onto this. The chlorophyll, it's found in barley.
Yeah. Chlorophyll is to plants what hemoglobin is to humans.
Wow.
Yes. Oh. So we cannot live without hemoglobin, no, because that's the main and most important ingredient or component of red blood cells, diba? Hemoglobin, no, and chlorophyll is that same. It has that same function with plants, no. Now, I actually want to stress this before I forget, no. We can learn about how to take care of ourselves, no, our bodies, just by observing nature, no. And you know how God made nature to serve, no, people, no, or mankind, is there are two important things, no, water and sunlight, diba? Libre yan, ha? Water and sunlight. And with water and sunlight alone, you have all of this green stuff growing around the world, diba? Well, in areas where there's no water, there's no tree, no trees. In areas where there's no sunlight, there are no trees or plants as well. No? So water and sunlight very important, yan. No? Now, when it comes to human beings, no, again, siyempre, water very important. 3 days without water, we're dead. No? And then the sunlight, the energy of the sunlight goes into the chlorophyll. Okay, now, that's where the energy is. Then we take it. That's why the Bible says take greens, diba? I'm giving that to you for your food because it is in the green foods like barley, no, that has the energy of the sun, no. So it's so simple, no. Take sun powered energy, no, which is green, which is barley. No, in our case, it's barley, and take lots of water, and with that alone, you're going to be healthy.
you change that the equation, no, and you take foods that you make yourself, foods that are canned, foods that are processed, water that's acidic, di ba? Eh, magkakaproblema talaga ang katawan natin. No?
Correct, correct. And barley is a green, okay? So it's very rich in chlorophyll. Ito yon, ito yung dinidiscuss ni Doc, no? So hemoglobin, 'di ba? Yung iron, yung nasa gitna in the human blood, and then the chlorophyll is the magnesium. Okay? It's a
Correct.
So
Yeah.
you can see doon sa ating mga trainings, no, the structure, the chemical structure of the plant chlorophyll and then the human blood, okay, the hemoglobin, halos pareho sila ng chemical structure. That's why when you drink your barley, your greens, you take your greens, no? It's very good for your blood.
Yep. Correct.
Tama yan. Dinrawing ko pa yung kanina, Ian. Nag-hydrogen ko. Hindi, kinopya ko lang. No, this is the one we always say with the barley, no, yung chemical. That's why it's really, really very important. Eh. Yung iba hindi nila yan naiintindihan. They just see it. Pero it's the way that Dr. Mike Novergara mentioned. It's the greens, no, especially the barley. Okay? So, major minerals ng barley, okay? It has sodium, chloride, potassium, calcium, phosphorus, magnesium, and sulfur. These are the major minerals na nandoon sa barley natin that is very good for our kidney health. Okay? So the minerals, as important as vitamins are, they can do nothing for you without the minerals. Okay? Vitamins cannot be assimilated without the aid of minerals. Although the body can manufacture vitamins, it cannot manufacture a single mineral. That's why we have to take lots of barley. All tissue and internal fluids contact varying quantities of minerals. Okay? So, again, dun sa pagkain na kinakain natin every day,
Yeah.
enough minerals.
The minerals have to come in from the food, di ba? And food, no, not all food are made equal, di ba? Food that is grown properly, no, organically, no, with rich soil. These are the foods that have the minerals. No, there are foods now, and most of the foods actually, they're grown in fields that have poison, no, herbicides and all, pesticides, fertilizers, lahat yan eh, no? So lahat ng chemical na yan, pumapasok din sa ano eh, sa food chain, yeah, sa vegetables or the foods that we grow, and then when we eat it, sumasama, no? Kaya importante na organic, 'di ba? Organic. Talagang taken care of ang lupa, no? Para the proper minerals, no? Will enter our body, no? Without all the negative pesticides and herbicides and fertilizers and all.
So, importante, that's why we always stress out that the barley, our pure barley is organic. It's only organic, it's certified organic. Diba yung ating, and then it has vitamins, okay? All natural vitamins are organic food substances found only in living things, that is plants, okay? Animals with few exemptions, okay? The body can manufacture or synthesize vitamins, must be supplied by essential to the normal functioning of our body. So ano pa yung hahanapin mo with the barley, with Sante barley? It's rich in vitamins, it's rich in minerals, okay? Thank you.
Yeah. Simple lang.
Yeah, what can you share more on the okay. Yes, Doc, I want you to share, just give your last advice on how we really take care of our kidneys.
Okay. The kidney kasi, no? Lahat ng nilalagay mo sa mouth, sa bibig or anything you swallow, almost for sure dadan sa kidney yan, no? And if it if it's a poison that you take, with your food, and there's a lot of that, the kidney will receive some of those, diba? And it can damage, it can damage the kidneys and other organs as well. Liver, it's also a filter, but the kidneys really do the day-to-day, hour by hour, second by second filtration. Tuloy-tuloy ang no? All fluids of the body will pass through the kidney. The kidney will separate the dirty fluid from the clean fluid. The dirty fluid will go out to urine. The clean fluid will be used for metabolism. Okay? Same thing with the blood. Diba? The blood will pass to the kidneys, and the kidney will split it into blood that is infected and blood that is not infected. Diba? And the blood that is not infected goes through the circulation talaga. No? Now, that's the reason why you have this dialysis machine. Diba? Because some people, their kidneys are already compromised, and they cannot separate the good from the bad blood. So they attach the blood vessels from the kidney into a machine. And it's that dialysis machine that takes out the bad blood and no. So this big machine, the dialysis machine, that does the work of a small fist-sized organ, of the body. You have to take care of that, These are the filters of the body. This is the one that will maintain your good health, diba? So that's always important. Of course, water will be the driving force, to throw out, to excrete all the toxins, including the oxalates, including the uric crystals, once when we eat food, some foods have high crystals like meats, beef, like that. Mataas yan, and if you don't have enough water that you drink, these crystals, they accumulate in the kidney kasi doon dumadaan, hindi hindi na-extract, dahil kulang sa tubig, to flush it out. So itong mga crystals nagkukumpul, until they become stones. If you look in the microscope at one crystal, parang yan yung jackstone. Di ba yung jackstone may 10 stone, tapos may isang bola. Yung na yan, yung maraming parang tusok-tusok, yan ang crystal. Diba? And it gets together when you do not drink enough fluids, di ba? Doon nagkakaproblema. Kasi nagkakakumpol, they stick together and then they cannot be flushed out anymore, di ba? So water and the proper food, that's the solution for almost all the organs of the body. But so you want good health in general, not only the kidney. You take the proper foods, which is the greens, and you take enough fluids. Now, last in Chinese medicine, the kidney is the source of all energy. Okay, when you're born with so much, they call it jing, jing qi, all the qi that you need to live your whole life, and through life, as we grow older, that qi goes less and less and less, and because we grow old and eventually we die, so that's where energy is concentrated. And you know why? You know why it's there? Because it is the kidney that processes vitamin D. And where do we get vitamin D? Sunlight. Okay? It's the kidney that processes vitamin D to convert it into energy in the body. Okay? So, important. Again, we go back to what nature is giving us. Water and sunlight. Okay? Sunlight, we take in the sunlight energy through food. Water, just take good, Okay? So, it's that simple. No? Study nature, study what the Bible says, and it's that simple. I hope it's simple. It sounds simple to me.
O yun nga yung basic, no? Like the essential that we've mentioned. No, just like drinking. Okay. So, Doc, maybe we can just answer a few questions in the chat. I will just read it for you. Okay,
Okay.
okay, this question, how about those taking their maintenance med? It said that damage our kidney.
Yes. Oh. There are many ways of treating, no? That's why it's important to go to a doctor who knows the various reasons why you are taking the medicine. Sabihin natin hypertension, di ba? Many of these hypertension medicines will affect the kidney and liver as well, no? What is the cause of your hypertension? Di ba? Again, if it's stress, why take a tablet, no? Try to address the stress. Is it because you have no control of your emotions, di ba? Maybe we teach you yoga, we teach you meditation, we teach you how to breathe properly, or we teach you how to forgive para hindi ka masyadong magagalit. Many of the people who get heart attacks, no? Meaning sa heart, na-heart attack sila dahil tumataas masyado at bigla yung blood pressure. Bakit? Kasi nagagalit. So
Yes.
many of these heart attacks happen in the boardroom, no? Where people start discussing business and whatever. They start fighting each other. They get hyper, di ba? So again, it's not medicine will not control that, di ba?
Mm.
That's what I do in my clinic. No? I get a patient and I see, no, and as much as possible, I try to take them away from medicines and chemicals. No, and there are foods that will help. There are techniques, breathing techniques that will help. There's prayer that can help. There's family support that can help. Di ba? Ang dami, ang dami. It doesn't have to be chemicals. And I
Yeah.
tell you, no, from my so many years of experience, maybe 36 years na yan, and counting, most of my patients who have hypertension, I take them out of medicines in maybe 3 months. Di ba? 3 months, medyo matagal na siguro yan. No? Even diabetes, same thing. No? Same thing. It need not be cured by chemicals because that's not the normal way it was supposed to be cured. Di ba?
Mm.
Cure it by proper foods, no? And enough water and proper foods. That's what Hippocrates said, di ba? Food is your medicine.
Yes.
Food is your medicine.
What would be your medicine and medicine
Yeah.
by food?
Yeah. Oh, eat properly, no?
Mm.
And how do you know how to eat properly? Get yourself educated, no? How long have we been educating you on barley, let's say, di ba? Because it's very important. It's not just something that is a commodity that you want to sell. No, no. It is a proper food to be healthy. No? So as I said before, di ba? Those who push barley push for good health. Those who push for good health are, well, you can say they're like doctors. Di ba? In fact, they're like many doctors don't even know. Di ba? Ang tinuturo sa amin is chemical, chemical, chemical. Everything's chemical. Di ba? How many units do we have of teaching people how to eat right? Di ba?
Nutrition.
Nutrition, wala. Wala talaga.
Okay,
Wala.
so how about tap water, Doc? Is it tap water
Eh,
is good?
It depends. It depends, no? On where you get your tap water,
O
no?
nga, baka
Oo.
yung
May,
pinanggagalingan naman kasi.
yeah. Yeah, because in tap water, no, in general, they put fluoride. Okay? In tap water, fluoride is a heavy metal. Okay? It can affect the brain. Although it's important, no, because it helps on dental health, ba? Pwede yan, no? The reason why they actually put fluoride in water initially was for dental health, ha? Mag-toothbrush ka na lang, di ba? And take,
Yeah.
and take the water of Ian, no? No, talaga, di ba? Oo. Because if you take it straight from the tap, which I used to do when I was a child, nung bata ko, wala pang bottled water. Talagang diretso sa, sa gripo ang, di
Sa
ba?
poso nga, Dok.
Ayan.
Nung araw, poso. O kaya sa hose.
Yeah, oo, talaga.
After mag-basketball.
Kaya tingnan mo ako, may brain damage na ako. Heavy metals, di ba?
Okay, so there's one question here. Dr. Mike, may I ask po? May client po ako bago lang nagpalaparoscopic
Yes.
Yes. Aywa. Okay, how barley can help? Or pwede ba siyang uminom ng barley?
Okay, like this. The proper diet and a healthy diet will help anything. Okay? Yeah, it'll help anything. Why? Because it's going to make you go to a position or a condition of optimum health. Okay?
Wow.
Diba? Oh, proper food, no? It will make you as healthy as possible. How can that help? It helps everything. Diba? It helps everything. That's why, ano talaga eh, tama talaga si Hippocrates eh, no? Kung student ko yan, eh, I'll give him a straight A eh.
Okay, so
No?
there's one question here. Does the kidney cyst affect the creatinine level?
What? That's a kidney
Cyst. CYS.
cyst.
Cyst.
No. Well, it can if it's invasive, di ba? And it's already damaging the kidney tissue. Pwede. But most of these kidney cysts are outside lang. Nasa labas lang eh. Nakapatong
Mm.
lang sa kidney eh. No? Ganyan normally ang cyst eh. Pero syempre, once in a while, there's a cyst that really invades the kidney. Pumapasok talaga. Yan, it can affect. No? But most of it doesn't.
Okay, so na-answer yung question nyo. Okay, so ito pa. But we'll limit this to okay, ito 8:30, 8:27. So we can let the doctor have his rest also. May question din po ako. Kapag ba ang isang kidney lumiit, kaya
Yes.
pa po bang bumalik sa normal?
It depends why, no? But normally, it's difficult, no, to regain kidney tissue, no. So, normally it will shrink for some reason, no. So maybe an infection, no. Hopefully, one kidney lang, diba?
Not,
Because that might not, it will be difficult for it to get back to normal size, no. But what happens here is now most of the function will be on the other kidney. So as long as your other kidney is healthy, nothing to worry about talaga.
okay, okay. So, Doc, paano po sa awaiting kidney transplant? How would you recommend? And how would it help the patient?
Kidney transplant for me is important, no? Especially for those with with irreversible kidney disease, no? Uh, a transplant that is done properly will make the patient parang go back to normal talaga, di ba? Normal filtration of ano. Now, the problem here in the Philippines is matagal ang ang pila, no, mahabang pila to get a kidney, no. Uh, if you have a relative with a kidney and it is compatible as well, no, ayan pwede pa, no. And our NKTI, National Kidney, no, and Transplant Institute, they're good at doing this already. Okay? Mga eksperto na yan. So if you want a kidney transplant, go check out NKTI, no? And it's best if you have already a donor, no?
Parang end stage na yun, di ba? Pagka may...
Yeah. End stage there, but after the kidney transplant, you're almost as good as new. No? And while waiting, you have to have your blood cleaned through dialysis.
Yes. Okay.
Up to such time.
Okay. Yan. So how do you recommend barley juice pag ongoing dialysis patient?
Or like regular, like regular, take it 2-3 times a day, no?
Okay. Oo. Kasi yung iba, sinasabi nila, since limited ang water intake, kunyari, 1-2 liters lang in a day, they just use 1 liter of that or half liter of that for their barley so they can drink it.
Well, no, well, you don't have to limit the barley, no? It's the water you limit.
Correct, correct.
Yeah. But the barley well, the barley will give you nutrition, di ba?
Yes.
Which you need, di ba?
Yeah.
Limit the water but not the barley.
Okay. Okay, so paano po, I think this will be my last, no? Paano po kapag madami yung kidney stones na nakita, tapos may bile duct cancer at heart complications, what can you recommend? Dami naman
It,
yung
it really depends on which is troubling the patient most, no? And how old the patient is. Because the age of the patient will determine whether you can do surgery or not. Diba? Now, may cancer, ano?
yeah, may heart.
Yung bile duct depends again on what stage of the cancer. Diba? So you have to prioritize which is the one that's doing the most damage. Most likely, it's not the kidney stones. Okay. Most likely, it'll either be the cancer or the heart.
Or the heart complications.
Yeah. Oo.
Age talaga, importante. That's why sometimes, kasi that's one factor. Kunyari, 80, 90 years old na yun. So, causative factor, no, the age.
Yeah.
Importante.
Oo.
So, tignan
Oo.
natin na ano.
Yeah. That's why, while we are young, no, you have to keep yourself healthy. Why? It takes a long time before you get to get a cancer. It takes a long time. No? Long time of not of not living properly, not eating properly. Yeah. No. It takes a long time to have a heart disease. No, unless you're born with it. No. And it also takes a long time to have kidney problems. That's why while you're young, no, while there's no problem yet, do the right thing already. No, eat properly, drink properly, diba? And all. And
Tama.
syempre lifestyle, no? No. Why? Because you will carry this all the way till you're old, no? It's difficult when you're old and you have all these aches and pains and di ba? All the sickness and all the
Okay.
people have to take care of you and all that stuff. No? It's nice if you're old and you're healthy pa, no?
Okay. Ito, I just want to clear this, no? May question. After uminom ng barley, tumaas ang creatinine. Paano naman natin malalaman na yung barley ang nag-cause ng pagtaas?
Correct. Yeah. You cannot say, it is because of that, no? Unless you do it in a controlled state, di ba? Na yan lang talagang ang kinain mo, no? For the whole time. Hindi. It cannot be, anything will change the creatinine. You taking medicine, no, the creatinine will change. You get dehydrated, the creatinine will
Yes.
change. Things like that, marami. No? Oo. You cannot blame it on food, no,
Yan
or
ang-
Kulang
on
din ang
one
boto.
particular food, especially a green food. Yeah.
Baka dehydrated din. Kasi,
Yeah.
and also may cleansing properties kasi ang barley. That could be one thing, but definitely it wasn't the initial cause. So,
Yeah.
blame it on the, maybe blame it on patis or the Coca-Cola you drank. Definitely not barley.
Correct.
It cannot be barley, It's just maybe coincidental that nag-increase, no?
Oo, di ba? Parang how can one product like organic, it's pure, with vitamins and minerals, can cause? Kasi minsan, di ba, Doc, kung ano yung last o yung bago sa kinain nila, yun yung nakikita parati.
Yeah. But remember again, these are the things that our bodies were meant to take in. Okay? We were made for this, or the barley and was made for us, no? The greens were made for us. We're compatible. No? We're compatible.
Yeah.
Anything
Tama.
aside from that, yan ang problema, di ba? Anything
Yeah.
aside from that, yan ang problema.
Correct. Okay? So,
Ako, I stick with it. Might have been the Coca-Cola or the or the
Yeah.
iced tea.
Yeah.
The drunk, definitely not the barley.
Do you know there's one emotion that that affects the kidney,
yeah.
and that emotion is the one emotion of fear. When you get scared,
Oh.
it affects the kidney so much, no? In fact,
Oh.
you will see in some movies, no? Sa takot ng tao, umihi.
Yeah.
Ba? Ganyan yan, no? It completely shuts down the kidney, no? So tumutulo kagad ang Oo.
Mm.
Fear. Now, What's their fear in the, you cannot tell, di ba? You cannot tell. You cannot blame the food talaga because there are just so many other factors that will affect it.
Tama.
Yes.
Thank you, Doc.
That's why holistic talaga tayo. That's why when we do our product training, no, 'di ba? Sinasabi namin sa lahat na being healthy does not mean physical lang. So dapat all aspects, no?
Correct. Correct. Oh.
Mentally, socially, spiritually, 'di ba? So
Kaya now they use the term wellness, di ba? Hindi na health eh. No? Are you well? Di ba? Are you well? Even WHO, no?
yun
It's
yung
are you well? It's not are you healthy? Di ba? Healthy, okay. What do you mean by healthy? Di ba? Okay ang blood pressure ko, pero stress ako, di ba? Hindi yan healthy. Di ba? Hindi yan healthy. Wellness ang importante. Overall.
Yeah. Overall talaga, no, Doc, no? While
Yeah.
you're drinking barley, maganda nga, no? You're in a happy state of mind.
Yeah.
Para
Oh.
talagang holistic.
Watch a corny slapstick comedy, di ba? So, tawa ka ng tawa. Uy, naku, laughing, ha? That's very important. That's very good.
Therapy
Laughing.
talaga ang laugh.
Yeah. Oo. It produces good hormones. Diba?
correct.
Good vibrations, good energy.
Total, oo.
So, gusto ko yung ni Doc na holistic mambing, no? Kaya talaga, everyday you have to live. Don't forget to live, to love, and to laugh.
Correct. Yeah. Dapat mababaw ang kaligayahan mo eh, no? If you, talaga. You know, people who pick on bakit ganyan, say ganyan. Ay, naku, they won't live a happy life and a healthy life. Kasi they nitpick on everything, no? Pero kung cool dude ka, yan,
dude.
ayos yan, no?
Yeah, dapat everyday you have you give yourself a chance to laugh. At least
Yeah.
once a day.
Yeah.
There was a doctor who told me before na bago ka daw matulog, tumawa ka. Sabi ko, nakakatawa.
Ding isa ka delikado.
Me, I do that. Pero me, as soon as I wake up and I look at myself in the mirror, ayan, tumatawa talaga ako. Sino ba tong tao to?
Oo.
Looks funny.
Okay. So
Sige.
I think it's all for now. So if you have more questions, do not hesitate to just send me a message. Pag hindi ko po alam ang sagot, alam nyo na, natatanungin ko lang si Doc Mikey. So if you want
Please send me your
yes.
questions.
You want to know his clinic number, again, just message me lang, Centro Holistico. He has 4 clinics, no? Philinvest Alabang. O di ba ina-advertise ko si Dr. clinic. He is one in South Ralios and Rockwell Grove, no? So, maraming salamat sa inyo, Doc Mikey. I'll be having
Thank
you
you.
next week. Next week.
Yeah. Okay. Thank you guys, ha? Ian, salamat.
Thank you, Doc. Thank you as always.
Yeah.
Thank you, Doc.
Okay.
Yeah.
So,
Thank you, people, for listening.
Yes.
Thank you.
Thank you. Okay, so you
Good
can
night.
always repeat, no, this one, listen from the doctor. Actually, iyan ganyan ang ginagawa ko din talaga, no? Kasi ito nga yung maganda. Pagkatapos ko, pwede naman natin ulitin. So, maririnig mo yung mga advices talaga ng doctor, no? Especially this topic. Okay, so merong isang tanong, kung pwede daw gamitin yung barley sa tap water. Pwede naman kasi maraming micronutrients yung barley, tapos yun yung tap water, konti lang yung pwede naman. Wala, ano yun? So you can use the tap water, okay? So ito, maganda yung sinabi niya. Dati daw palakain ng junk food, milk tea, and soft drinks. Ngayon, Santay Pure Barley Juice na ang iniinom. Thank you, Miss Paisan. Okay, so maraming salamat for your question. Maraming salamat for listening to us. Again, just continue, listen. I'll be having more health topics, health conditions. In fact, meron akong, sabi ko nga kay Ian, meron akong isang wini-work out, having the research again. Laboratory test naman ang aking i-discuss. Yung HDL nyo, creatinine nyo, mga blood test, no? So, mataas, mababa, ano ang tama? That's my working title. Tinatapos ko lang po yung ating slides na to at paano makakatulong si Barley sa ating mga diagnostic test, laboratory test na napaka-importante naman po talaga. So again, do not forget to drink your barley every day and your vitamin C. We cannot afford to get sick, lalo ngayon sa panahon na to, no? So, maraming salamat. Sabi nga, being healthy does not mean changing your life overnight. Hindi bukas uminom ka ng barley, magaling ka na. Hindi po. So, every day, just drink barley every day. Tapos, palakasin natin ang ating sistema with our NutriPair, okay, vitamin C pa din at saka yung barley, okay? So with that, maraming salamat, Ian. I would just like to end this presentation by listening to the music. Okay, so tomorrow, Millennials in Business, MIB, by 7 o'clock, okay? Speaker po natin si Stephanie Garate. She's a Yellow Diamond Executive Director. Mag-share si Isa Ariola Necor. She's a Platinum Executive Director and our Kalibo Aklan Branch Operator. Very young person, a very young lady, no? Elaine Panopio, no? Kasi mga millennials in business, Diamond Executive Director, do not forget to attend tomorrow and hear from these great ladies, no? Tomorrow.
Yes. Ma'am Bing, also, I'll add, no, aside from Millennials in Business at 7 p.m., we have a sneak preview ng e-lead program ni Sir JP and Sir George at 3 p.m. So, see you tomorrow, 3 p.m. for the e-lead Empower Series preview. And by 7 p.m., we have this one, the Millennials in Business, featuring Steph, Isa, and Elaine Panopio. Okay, so see you tomorrow. Sige, Ma'am Bing, let's play Noel Cabangon's song.
Okay, so I'm just sharing my screen. Okay, just hear it. Hear this song. Thank you very much and God bless everyone.
Man ang simula, di ito ang katapusan. Kapag may pangarap na,
Picture. Smile, picture tayo.
di natitina at di susuko hanggang makamit masaganang buhay.
Dahil sa Sunday, meron na akong time and financial freedom ngayon.
Dahil sa Santay, I'm driving my own car now at nakakapag-travel pa ako around the world.
Dahil kay Sante, I achieved my first brand new car at a young age.
Nang dahil sa Sante, nakakuha kami ng car and house incentive.
Anuman ang pagsubok o hamon ng buhay, kaya mong makamit masaganang buhay.
Dahil sa Santay, nagkaroon po ako ng maraming gadget. Nagkaroon po ako ng sariling brand new car. Ang kagandahan pa po nito, nagkaroon sa sariling brand new house and land.
Nang dahil sa Sante, nagkaroon ako ng brand new car.
Dahil sa Sante, nabayaran ko ang aming mga utang at ngayon nai-enjoy ang residual income at free travels.
Nang dahil sa Sante, nagkaroon ako ng car, travel, and gadgets.
Dahil sa Sante, natupad ang aking pangarap na makapagtapos ng pag-aaral.
Nang dahil kay Sante, I am now living a comfortable life with
aking pamilya while enjoying my growing business.
Kapag may pangarap ka, alagaan ang sarili at kalusugan hanggang makamit masaganang buhay.
Nang dahil sa Sante,
Nakabili kami ng bagong sasakyan
nakapunta sa iba't ibang lugar.
at malaki ang naitulong sa amin ngayong panahon ng pandemya.
Dahil sa Sante, unti-unti ko nang nakukuha ang mga pangarap ko. Big savings, travel.
Dahil sa Sante, unti-unti ko lang nakuha aking mga pangarap. Makapag-travel ng ibang bansa at higit sa lahat, mabigyan ko ng magandang buhay ang aking family.
Dahil sa Sante, nakapagpatayo ako ng bagong bahay.
With Sante, nakuha na namin ang aming pangarap na gadget, sasakyan, and travel!
Dahil sa Sante, nagkakotse na ako.
Dahil sa Sante, nakabili na ako ng sasakyan, sariling bahay at napag-aaral ko ang aming mga anak sa school na gusto ko.
Kaya mo abutin ang pangarap mo, bituin. Kaya mo tawirin daan may madilim. Kaya mo abutin ang pangarap mo, bituin. Kaya mo tawirin daan may madilim. Makakamtan, inarasal, mananangin sa may kapal.
Panatagalan sa Sante.
Well, thank you very much for joining us tonight sa ating Doctor's Wellness Training. Am I still on? So, please also, sa lahat na kasama natin dito sa Zoom, you can answer this evaluation survey form. And I'm pasting it right now sa ating chat box. Okay, so thank you very much for joining us. We have the form right now sa ating chat box. So, sa lahat na kasama natin dito sa Zoom, I hope you guys will answer the evaluation survey. If you enjoyed tonight's discussion about kidney health together with Dr. Mikey Vergara and of course, Ma'am Bing Kalinawan, and a few seeing it from me, no? Ako kasi, Ma'am Bing, yun lang, I'll always want to share whatever I can, especially sa health. So, shout out nga pala sa ating mga maraming ACE ngayon, eh. Nakita ko si Ma'am Ace, Esther, Sarah. Sino-sino pa ba yung mga ACE na yan? Madali makita kasi A agad eh. But then, of course, syempre, mga regulars natin, Mary Flora. Hindi mawawala yan. Early bird lagi yan, Ma'am Bing, no? Angelica Danao, MM Pangilinan, Esther Sara, Helen's iPhone, Maricel Boston Fabila. Who else is here? Michelle Manaog, Maricel Fabila. Who else? Glenda Makiling, Tess Banyes. Yan, dami. Catalyst, ang dami rin. Ma'am Chi Abawag. Hi, Ma'am Chi. Good evening. So again, this is Sir Ian Pagkalunga together with Ma'am Bing Kalinawan. Pagpahingin na natin si Ma'am Bing. Maghapon na rin kami sa mga meeting. So thank you very much for joining us tonight sa ating Doctor's Wellness Training. Kung nagustuhan niyo po, share niyo lang po ang video na ito. At huwag kalimutan, nga pala, no, may bagong directive kami. I-like naman niyo ang ating Engage page saka Engage YouTube. Saka alam niyo ba, pwede kayong mag-send ng stars. Baka may laman yung mga Gcash nyo, pwede naman kayo mag-send daw. Sabi ni Miss Janlyn yun, hindi ako. So, follow yung ating Engage. I-share nyo po sa buong lahat ng mga Sante business partners nyo. So, supportahan natin ang Engage by liking and following Engage saka yung ating Engage YouTube channel. So, yun lang, Ma'am Bing. Thank you very much and good night, everybody.
Thank you, Ian. Maraming salamat, everyone. Ulitin nyo tong just listen. See you tomorrow.
Maganda yung natin yan. Very informative.
Yes.
Bye-bye.
Thank you. Bye.
Ending the live in 5, 4, 3, 2, 1. Bye.